Hey there, Dr. Luke here. We're going to go through a hip cars in the sideline position, a controlled articular rotation. So I like to use a yoga block here just to rest my head on. And we're going to come down in the sideline position, arms out in front, legs nice and straight. And we want to breathe in and irradiate, contracting our whole body about 30% so that we've got a good base for our working joint. In this case, my hip to work around. So we want to start here, irradiate, breathe in and irradiate. We want to flex the hip up as far as we can, searching for that greatest range. And now I'm going to abduct, and we're going to come to a roadblock here. So I need to internally rotate the hip here. So internally rotating the hip, extending back, and then coming back as far as we can. We out, moving the lumbar spine and coming back into that neutral position there. Now we're going to extend back, and this is when we're going to come to a roadblock here, so that we start externally rotating the hip, externally rotating, really explore for that outer range in that rotation, and then coming back into that neutral position. Let's do that once more. So we're going to flex the hip, breathe in and irradiate first of all, of course. Then we're going to flex the hip, coming up as far as we can. Then we abduct, come to that roadblock. Now that we're internally rotating the hip, extending back, try not to move that lumbar spine, and back into that neutral position. Now we're going to extend back. We'll come to that roadblock. We need to externally rotate the hip, searching for the greatest rotation and range, flexing up and abducting, and coming back into that neutral position. So that's how you would do 2 reps of hip cars. It's really important that you move in your pain-free range. Any pinching or any sharpness in that hip, you pull away from, and then just explore the range that you can do in that pain-free range. So this is going to help maintain the movement that you already have, increase the movement as well, but also get all those sensors firing around that joint. Information to the brain allows you to coordinate movement and have greater control of that joint. So this is going to build the foundation of a good, healthy, functioning hip joint, and that's how you do a hip cars.